On November 24, 2012, a young woman named Laura traveled to Bangkok, Thailand, brimming with a potent mix of excitement and apprehension. Her journey, born of a deeply personal desire for transformation, would soon twist into a harrowing nightmare, leaving her forever scarred, not just physically, but emotionally. What began as a hopeful pursuit of self-improvement would unravel into a devastating saga of medical malpractice, a tale of beauty sought and identity lost, and a relentless fight for justice in a foreign land. Laura, like countless others, had been drawn to the allure of medical tourism, specifically the promise of affordable, high-quality plastic surgery in Southeast Asia. For years, she had felt a quiet dissatisfaction with her appearance, a feeling that gnawed at her confidence and shadowed her self-perception. After extensive research and what she believed to be diligent vetting, she chose a clinic in Bangkok, a facility that presented itself with an air of professionalism and boasted glowing testimonials. The clinic's website, a carefully curated digital storefront, showcased smiling, confident patients and promised life-changing results. It was a siren song, luring her with the vision of a happier, more self-assured future. She meticulously planned her trip, saving diligently and coordinating every detail, from flights to accommodation. The initial consultations, conducted remotely, were reassuring. The surgeon, a man with seemingly impeccable credentials, exuded confidence and expertise, patiently addressing her concerns and outlining the procedures she desired: a breast augmentation and a rhinoplasty. He painted a picture of a smooth, successful recovery, a swift return to her life. Albeit with a new, enhanced appearance, Laura arrived in Bangkok with a heart full of hope. The bustling city, a vibrant tapestry of sights, sounds, and smells, initially offered a sense of exotic adventure. Yet beneath the veneer of excitement, a subtle undercurrent of anxiety began to stir. The clinic, while outwardly presentable, possessed a clinical, almost impersonal atmosphere that contrasted sharply with the warm, reassuring tone of their online presence. Still, she pushed these nascent doubts aside, reminding herself that she was here for a medical procedure, not a luxury vacation. On the day of her surgery, Laura was prepped with a sterile efficiency that bordered on detachment. The operating room, a cold, brightly lit space, felt less like a place of healing and more like a sterile factory floor. As the anesthesia took hold, she drifted into an unconscious state, trusting implicitly in the hands of the medical professionals surrounding her. She awoke hours later, groggy and disoriented, her body throbbing with a dull, persistent ache. The initial moments of recovery were a blur of pain medication and fragmented instructions. Swelling and bruising were expected, she was told, a normal part of the process. Yet, as the days turned into a week and the initial discomfort began to recede, a chilling realization slowly dawned upon her. Something was profoundly wrong. Her breasts, rather than appearing subtly enhanced, were unnaturally large, misshapen, and hardened. The incision lines were jagged and angry, refusing to heal cleanly. Her nose, a focal point of her desired transformation, was even more distressing. It was crooked, lopsided, and breathing had become an arduous task. The mirror reflected a stranger, a distorted version of herself that ignited a spark of panic deep within her. The promise of a better future had dissolved into a grotesque reality. She confronted the clinic staff, her voice laced with growing alarm. Their responses were dismissive, bordering on condescending. They assured her these were merely temporary side effects, a normal part of the healing process. "Give it time," they insisted. "The swelling will go down, and everything will settle." But Laura knew, with a certainty that chilled her to the bone, that this was more than just swelling. This was a catastrophic failure, a betrayal of trust, and a violation of her body. The clinic, once a beacon of hope, had become a source of profound despair. She felt trapped, isolated in a foreign country, her dreams shattered and her sense of self irrevocably damaged. The emotional toll began to mount, a heavy burden that pressed down on her spirit. Tears became a constant companion, a stark contrast to the hopeful excitement that had propelled her to Bangkok. She was alone, vulnerable, and the path to reclaiming her life seemed impossibly long and fraught with uncertainty. The physical pain was relentless, but it was the emotional agony, the profound sense of loss and disfigurement that truly consumed her. Her journey for beauty had yielded only disfigurement, and the consequences would haunt her for years to come. Laura's pleas for assistance and explanation at the clinic were met with increasing resistance and eventually outright hostility. The initial dismissiveness morphed into a stonewalling tactic. Her concerns were brushed aside as overreactions, her pain minimized, and her growing anxiety dismissed as mere impatience. The smooth-talking surgeon who had initially won her trust became evasive, his once reassuring demeanor replaced by a cold professionalism that left her feeling isolated and unheard. She attempted to communicate her distress, describing the severe pain, the alarming asymmetry, and the profound difficulty breathing through her altered nose. Each complaint was met with the same placating, unconvincing assurances. "It's normal," they would repeat, a mantra designed to quell her fears rather than address the underlying medical failures. The staff, once seemingly attentive, began to avoid her, their eyes darting away when she tried to engage them. It was clear they were unwilling to acknowledge the severity of her situation, perhaps even actively attempting to conceal it. Feeling increasingly desperate and realizing the clinic would offer no genuine help, Laura decided to seek a second opinion. This decision, however, proved to be an unexpected hurdle. She discovered that getting an independent medical assessment in a foreign country, particularly when embroiled in a dispute with a local clinic, was fraught with challenges. Language barriers, unfamiliar medical systems, and a pervasive sense of loyalty among local practitioners made her quest for an impartial diagnosis incredibly difficult. Yet her determination, fueled by a potent mix of fear and indignation, spurred her onward. She navigated the labyrinthine streets of Bangkok, seeking out other hospitals and clinics, only to be met with wary glances and polite but firm refusals to get involved. The medical community, it seemed, was a tight-knit network, and few were willing to openly criticize a peer, especially to a foreign patient. After numerous setbacks and mounting frustration, Laura finally found a sympathetic ear in an internationally recognized hospital. The doctors there, more accustomed to dealing with complex cases involving foreign patients, agreed to examine her. The examination was thorough and somber. As the doctors assessed her condition, their expressions grew increasingly grave. Their silence spoke volumes, confirming her deepest fears. The diagnosis, delivered in hushed professional tones, was devastating. The breast augmentation, they explained, had been performed incorrectly, resulting in encapsulation, the formation of a hard, fibrous capsule around the implants, causing severe pain and distortion. The implants themselves were poorly sized and incorrectly placed, but it was her nose that presented the most egregious errors. The rhinoplasty had not only failed to achieve the desired aesthetic outcome, but had also severely compromised her nasal passages, making breathing incredibly difficult and necessitating extensive reconstructive surgery. The independent medical report was a damning indictment of the initial procedure. It meticulously detailed the numerous complications, the substandard surgical techniques, and the undeniable evidence of medical negligence. The report also highlighted the immediate need for corrective surgeries, warning that delaying treatment could lead to further, irreversible damage. Armed with this official documentation, Laura returned to the initial clinic, no longer pleading but demanding accountability. She presented the report, expecting a moment of truth, a flicker of remorse, or at least an offer of remediation. Instead, she was met with outright denial. The clinic vehemently rejected the findings of the independent report, dismissing it as biased and inaccurate. They insisted their procedures were flawless, their surgeons impeccable, and that any issues Laura was experiencing were either imagined or a result of her own failure to follow post-operative instructions. It was a calculated act of gaslighting, designed to sow doubt and shift blame. The meeting quickly devolved into a heated confrontation. The clinic staff, previously just dismissive, became openly aggressive, threatening legal action if she continued to slander their reputation. They implied that she was attempting to extort them, a common tactic used to intimidate vulnerable patients. The contrast between the clinic's initial polished presentation and its current belligerent defense was stark and terrifying. Laura realized then that she was not dealing with a legitimate medical institution that had made a mistake, but with an entity more concerned with protecting its image and profits than with patient welfare. The dream of a beautiful transformation had not merely evaporated, it had been violently snatched away, replaced by a grim struggle for justice. The fight for her physical and emotional recovery would now be inextricably linked to a daunting legal battle, waged alone in a foreign land. The quiet despair that had settled upon her intensified, giving way to a fierce, unyielding resolve. She would not be silenced, nor would she allow her suffering to be dismissed. This was no longer just about her appearance. It was about holding those responsible accountable for the profound damage they had inflicted. The legal landscape in Thailand, particularly concerning medical malpractice, proved to be an intricate and formidable maze for Laura. Unfamiliar with the nuances of Thai law, she faced an uphill battle from the outset. Her initial attempts to secure legal representation were met with a mixture of sympathy and caution. Many local lawyers were hesitant to take on a case against a well-established clinic, especially one involving a foreign patient, due to the inherent complexities and potential for prolonged, arduous proceedings. The concept of medical negligence, while recognized, was often challenging to prove in practice, requiring extensive documentation, expert testimonies, and a deep understanding of local legal precedents. Furthermore, the cultural inclination to avoid public confrontation and maintain social harmony sometimes played a role, making it difficult to find advocates willing to pursue aggressive litigation. Despite these obstacles, Laura's resolve remained unbroken. She understood that securing justice would demand unwavering persistence and an immense financial burden, but the alternative, to simply accept her fate, was unbearable. She finally connected with an international law firm specializing in medical tourism cases, a firm with experience navigating the intersection of foreign legal systems and patient advocacy. Their initial assessment of her case, while acknowledging the significant challenges, provided a glimmer of hope. They confirmed that the independent medical report she possessed was a crucial piece of evidence, a testament to the egregious errors committed. The firm began the arduous process of gathering additional evidence. This involved requesting her complete medical records from the Bangkok clinic, a process that was, predictably, met with stonewalling and obfuscation. The clinic attempted to delay, deny, and even alter records, forcing the legal team to exert considerable pressure. Simultaneously, they sought further expert opinions from renowned surgeons in Laura's home country, surgeons who could provide objective assessments of the standard of care she should have received versus the reality of her botched procedures. These experts meticulously reviewed her images, surgical notes, and the independent Thai medical report, corroborating the findings of severe negligence and identifying specific deviations from accepted medical practices. The emotional toll during this period was immense. Each legal hurdle, each dismissive response from the clinic, each revelation of the extent of the damage to her body, chipped away at her resilience. She struggled with chronic pain, disfigurement, and the psychological scars of her ordeal. Simple daily tasks became agonizing, and the once vibrant young woman found herself withdrawing, plagued by anxiety and a profound sense of betrayal. The corrective surgeries she desperately needed were postponed as the legal battle unfolded, exacerbating her physical discomfort and prolonging her emotional suffering. Her legal team advised her that undergoing further surgeries before the completion of the legal process could complicate her case, potentially allowing the clinic to argue that her subsequent treatments were the cause of her ongoing issues rather than their initial malpractice. This meant living with her disfigurement, enduring the pain, and facing the world with a constant, visible reminder of her shattered dreams. The financial burden also grew exponentially. Legal fees, expert witness costs, travel expenses, and the accumulating medical bills for her ongoing pain management and future corrective surgeries threatened to overwhelm her. Yet she pressed on, drawing strength from the injustice she had suffered and the belief that she had a right to heal, both physically and legally. The legal battle became a fight not just for compensation, but for recognition of her suffering, for accountability, and for a powerful warning to others considering medical tourism. It was a testament to the enduring human spirit to seek truth and justice, even when facing seemingly insurmountable odds. The quiet young woman who had embarked on a journey for beauty had been forged in the crucible of adversity into a fierce advocate for herself, determined to ensure that her devastating experience served as a cautionary tale for others. As the legal proceedings slowly ground forward, Laura found herself facing a profound psychological battle, perhaps even more challenging than the physical and legal ones. The initial shock and panic had given way to a deep, pervasive trauma. Her reflection, once a source of minor dissatisfaction, now evoked a visceral reaction of distress and alienation. She no longer recognized the person staring back at her, the physical alterations serving as constant, painful reminders of the ordeal she had endured. The botched surgeries had stolen not just her desired appearance, but also a fundamental piece of her identity and self-worth. Simple social interactions became agonizing. She felt hyper-aware of her disfigurement, convinced that every glance, every whispered comment, was directed at her altered features. This intense self-consciousness led to a retreat from public life. She avoided mirrors, photographs, and social gatherings, her world shrinking to the confines of her immediate surroundings. The vibrant, outgoing young woman she once was had been replaced by a withdrawn, anxious individual, grappling with profound body dysmorphia and a crippling lack of confidence. Sleep offered little respite. Nightmares, vivid and unsettling, replayed the sterile operating room, the dismissive faces of the clinic staff, and the horrifying revelation of her post-operative appearance. During waking hours, intrusive thoughts and flashbacks would ambush her, plunging her into spirals of anxiety and depression. The world, once full of possibility, now seemed a dangerous and unpredictable place where trust had been irrevocably shattered. Her legal team, recognizing the severity of her psychological distress, encouraged her to seek professional help. Therapy became a crucial lifeline, offering a safe space to process the overwhelming grief, anger, and fear she carried. Through countless sessions, Laura slowly began to unpack the layers of trauma, confronting the betrayal, the loss, and the devastating impact on her sense of self. It was a slow, arduous journey, marked by setbacks and moments of profound despair, but also by small, incremental victories. The therapist helped her to understand that her reactions were normal for someone who had experienced such a profound violation, and to gradually reclaim agency over her own narrative. While the legal battle demanded her focus on external justice, therapy allowed her to begin the internal work of healing. She started to differentiate between the physical scars and the emotional wounds, understanding that while the former might require further surgical intervention, The latter demanded careful, compassionate tending. During this period, the corrective surgery she desperately needed remained on hold, a constant source of physical pain and emotional frustration. The delay was a strategic move by her legal team, aiming to maximize her compensation by allowing the full extent of her suffering to become evident. However, this meant enduring the discomfort and disfigurement for an extended period, a testament to her unwavering commitment to justice. She learned to manage the chronic pain with a combination of medication and therapeutic exercises, but the constant reminder of her altered body was a relentless psychological burden. The battle for her life once, about an aesthetic enhancement, had transformed into a fight for her very identity, her mental well-being, and her ability to live a life free from the shadows of her past. She started journaling, documenting her emotional journey, finding a small measure of control in articulating her pain and anger. This practice, initially a private outlet, eventually became another form of evidence, a raw and honest chronicle of her suffering that would later inform her legal claims. The journey of healing, she discovered, was not a linear path but a winding road filled with unexpected detours and challenges. Yet with each step, however small, she began to rebuild, to rediscover her inner strength, and to envision a future where her identity was defined not by her scars, but by her resilience. Years after her fateful journey to Bangkok, Laura's tenacious pursuit of justice finally culminated in a legal victory, albeit one that brought a bittersweet mix of relief and lingering pain. After protracted negotiations, meticulous evidence presentation, and the unwavering advocacy of her legal team, a settlement was reached. The terms, while confidential, acknowledged the clinic's culpability and provided Laura with substantial compensation for medical expenses, lost income, and the profound pain and suffering she had endured. It was a moment of vindication, a public affirmation that her claims were legitimate and that she had been wronged. The financial award, while significant, could never fully erase the physical and emotional scars, but it did offer a crucial pathway forward. It meant she could finally access the extensive corrective surgeries she desperately needed, procedures that would begin the long process of repairing the damage inflicted upon her body. It also provided the financial security to continue her intensive psychological therapy, an ongoing necessity for healing the deep-seated trauma. The first series of reconstructive surgeries were arduous, demanding immense patience and resilience. Each procedure, though offering the promise of improvement, also brought renewed pain, swelling, and the anxiety of potential complications. It was a stark reminder of the initial nightmare, but this time, she was under the care of highly skilled and compassionate medical professionals who prioritized her well-being. The road to physical recovery was painstakingly slow. Her breasts required multiple revisions to correct the encapsulation and asymmetry, and her nose necessitated complex reconstructive work to restore both aesthetic balance and functional breathing. With each surgery, however, came a noticeable improvement, a gradual return to a semblance of her former self. The physical changes, though still imperfect, brought a sense of quiet relief and a renewed glimmer of hope. Beyond the physical healing, Laura dedicated herself to advocating for greater awareness and regulation within the medical tourism industry. Her personal ordeal transformed her into an accidental activist, driven by a powerful desire to prevent others from suffering a similar fate. She shared her story, initially with trepidation, then with growing confidence, on online forums, in support groups, and eventually in interviews with journalists. Her narrative became a cautionary tale, meticulously detailing the red flags she had missed, the deceptive practices employed by unscrupulous clinics, and the devastating consequences of inadequate research and oversight. She emphasized the critical importance of vetting surgeons' credentials, understanding the legal recourse available in foreign countries, and prioritizing safety over cost. Her advocacy extended to collaborating with organizations working to establish international standards for medical tourism, pushing for greater transparency in clinic advertising, and demanding more robust patient protection laws. She spoke passionately about the psychological toll of medical malpractice, urging potential patients to consider the comprehensive risks, not just the physical ones. Laura's journey, which began with a personal quest for transformation, had unexpectedly led her to become a voice for systemic change. Her life, once defined by disfigurement and despair, was slowly being reshaped by resilience, advocacy, and a profound sense of purpose. While the scars, both visible and invisible, would forever be a part of her story, they no longer consumed her. Instead, they served as a testament to her strength, a reminder of the darkness she had overcome, and a beacon for others navigating the treacherous waters of medical tourism. Her experience was a powerful illustration of how the pursuit of beauty, when placed in the wrong hands, can lead to irreversible devastation, and how one individual's fight for justice can ignite a movement for change. Laura, the victim, had emerged as a survivor, an advocate, and a living testament to the human spirit's capacity to heal, adapt, and ultimately, to make a difference.